This is a case of liver cirrhosis of the liver, and you can see that the outer surface of the liver is irregular. This is the outer surface. Let me magnify to make it more clear that the outer surface of the liver is irregular. This one, you see, this is the outer surface. The parenchyma is coarse, and this is the gallbladder with thick echogenic walls being seen because of the adjacent liver parenchymal disease, and no pathology otherwise. Well, this is the portal vein, as you can see here. Now this is the portal vein, the gallbladder, the portal vein is patent, the flow is normal, and now this, you see there is a hypogoic area seen in the posterior segment of the right lobe. This one. Now this is the focal area, focal lesion rather I will say. At measures approximately 3.5 centimeter by 3 centimeter, and is in the posterior segment of the right lobe of the liver. Now when I move it, it becomes longitudinal. Just concentrate. Now you see. Now this is all. This is all consistent with the cirrhotic liver. Okay, fine. Now this hypogoic area, from here to here, and from here to here, and then from here to here, you can see it hypogoic. It's with ill-defined outer margin, and now if it is seen in a triangle shape in this at this side, when I will move the probe 90 degrees, you see I have moved the probe 90 degrees, and I see the same structure being circular. So in fact, this globular area and this triangular area are the same. The trick is, whenever you see a globular area, always give us a sweep of 90 degrees or so, and if it changes its shape, then it's not focal lesion, and that's why I'm going to label it as an area of focal fat spared area. This is also a focal fat spared area. This is a focal fat spared area in cirrhotic liver. Now you see the internal configuration. If you see the normal, relatively normal liver parenchyma in this region. So this is something of interest that one may not label as an aggressive pathology, though we do not see any posterior wall enhancement from it, and it is not an abscess because it changes its shape. It's not an cystic mass. It's not an aggressive lesion, because had it been an aggressive lesion, it would have not changed its shape. So here I'm going to do it again for you. Here you see again it changes its shape. Okay, not only this. There is another focal fat spared area. This one. This is the focal fat spared area. Now here, now you see there is another lesion seen in the anterior segment of the right lobe. This one. See, it's irregular in outline. It has internal tiny calcifications, and no significant vascularity is seen. I'll show you in a while. But this lesion is measuring irregularly outlined, measures 4.1 into 3.5 centimeters, and now this area is also being, because it's irregular in outline, it's also consistent with focal fat spared area. In this location. Here it comes again. Just concentrate on the, now you see there is another satellite lesion. This is the lesion. This is also focal fat spared area, and see the vascularity. Now you see the vessel passes straight, sorry, the vessel is passing straight through this focal lesion, and had it been a solid mass, then it would, the vessel would have diverted around its margin from here or either here, whereas we are seeing that the vessel is passing straight through it, so it is also a focal spared area in the anterior segment. Here you see, this is the lesion, magnified, and you can see the vessels traversing normally through this region of focal fat spared area. This is the focal fat spared area, and we do see vasculature, vessels passing straight, taking their normal path that they usually do, and no deviation of their normal route. So this is a case of cirrhosis of the liver with multiple focal fat spared areas within it. There you see. Okay, thank you very much.